Welcome to patient 9. Why is TAVR preferred over open heart surgery? OHS, graphic representation of the positioning of TAVR. Now to the main part. Aortic valve stenosis is a mechanical impairment in the functioning of the aortic valve. This means it cannot be managed by medications alone and requires an interventional procedure to fix or replace the valve. For a long time, open heart surgery, OHS, for the replacement of an aortic valve with a mechanical artificial valve has been the treatment of choice in patients both over and under 65 years of age. It is a highly invasive and risky procedure associated with increased complications and requires longer hospital stays and regular follow-up checkups. Doctor performing open heart surgery. With time, there has been a need for an alternative option for older patients, greater than 65 years, who have severe aortic stenosis exhibiting signs and symptoms, or those who are at high risk of complications from surgical aortic valve replacement, TAVR, due to advancing age, an underlying health condition, or suppressed immune system. And this is where transcatheter aortic valve replacement, TAVR, comes in. Although TAVR is now the treatment of choice for high-risk patients in the older age group, studies are still underway to employ this procedure as a first-line treatment option for patients younger than 65 years of age. If you would like us to alert you when TAVR receives approval for patients under age 65, sign up here. Thank you for watching this video.